Welcome to the labor prep workout. Today's focus is going to be on counter pressure techniques, so you're going to learn how to do the double hip squeeze, the pelvic press, and also sacral counter pressure. The equipment that you'll need is something to lean onto, so like your kitchen counter would be like a great option, or like your kitchen table. And then you're going to want something to be able to lean onto in an all fours position, such as like a birth ball or a stability ball, or even just your couch or a chair. You can also just use your hands to be in an all fours position as well. The first counter pressure technique that we're going to use is going to be the double hip squeeze. So you're going to look for the femur head, you're going to put your palm in the little gap right above that, and then fingertips are going to be facing towards the spine and kind of a diagonal as you push up and in. If you need more of a breakdown of the counter pressure techniques, watch the demo videos that came before this labor prep workout, because that's really going to break it down for you. But that's just like a quick refresher. Look for the femur head, palm is in that little indented portion, fingertips up and in. And as we do counter pressure, it's going to be important to communicate with one another on should you go a little bit higher, a little bit lower, more or less pressure. And then know that counter pressure is going to be pretty fatiguing for you as the birth partner, because it's going to be a lot of chest to really squeeze for that entire time. So if you need to take breaks throughout the 2 minutes, feel free. So how the labor prep workout is going to work is we're going to do 30 seconds of squats. You can either just do body weight squats, or you can hold onto your partner's hands to make it a supported squat. And then it'll be 2 minutes of focusing on a labor position using a counter pressure technique, and then really focusing on trying to help bring your heart rate and respiration rate down to kind of calm yourself down and focus on relaxation. You may find that certain laboring positions feel really comfortable for you and other ones do not. And so pay attention to which ones feel most achievable for you and which ones you feel like you can relax into a lot more. So we'll go ahead and get started. So starting with our supported squats, you can either just do them body weight, or you can hold on to your partner's hands. We're going to inhale on the way down, exhale as we come up. So the focus of these squats is just to make ourselves tired, so we're not really worrying about how deep we go or making this like a super strenuous portion. It's just to make us more fatigued. So the first position we have is just a standing laboring position. So you can just stand and sway, and then your partner is going to look for that femur head, and they're going to find that little pocket and squeeze up and in. As a partner, you want to focus on finding a position that is comfortable for you as well. And then just begin to breathe here, big inhales to feel everything expand, and then exhale, just let go. During these laboring positions, we're just focusing on trying to bring our heart rate down, our respiration rate down, and then you guys can practice the counter pressure techniques and knowing how to find a comfortable position for both of you. If you as a birth partner are getting fatigued in this movement, feel free to rest and then come back to it. 2 minutes is a lot longer than a normal contraction would be. So just working together to learn this movement, to find comfortable positions is what's really the focus. And then remember to communicate. Do you want more pressure, less pressure? Do you want them to move a little bit higher or a little bit lower? These workouts are about exploring this together. About 10 seconds left.